want to do. Good to go. We're all done.
Okay, sounds good. Well, we will get going with our Board of Health meeting this morning. I'll pass out agendas to those in the room, and they're up on screen for everybody else here. So today we have present our board members, Ken Bassman, Randy Morris, Gary Dale, Carmen Stagg-Miller, and online Barb Schaefer. Board members absent today are Laura Weir and Sam Carlson. And then we also have Melody Martinson from the Acantha in the room, and Katie Adams with the Health Department. I'm Melissa Moyer with the Health Department. Claire Hodgkiss with the Health Department is also on, and then I believe we have Van Puckett, who is our contract sanitarian, also online. And we'll give him some time to chat with you guys here later in the agenda. So, or is it? Sorry, Delilah. Is it? Are you sanitarian online? Is it Delilah or Van?
Are they muted?
Oh, it looks like maybe it's Delilah. Okay, which is, if I understand correctly, Delilah is new to the team with the sanitarians and happens to be Van's daughter. So anyway, we're excited to have her, and I haven't had a chance to meet Delilah in person yet. But okay, so we will do first minutes from our December meeting. Did you guys, Gary, thanks for your feedback. I did make some changes after you emailed. So the new minutes have an adjustment about Gary's resignation that did not happen prior to the meeting. He just at the meeting mentioned that we should start looking for a new health officer and medical advisor for the health department. So I made that adjustment. Did anyone else have any changes to the minutes?
I thought they were good.
Does somebody want to make a motion to approve one?
Motion.
Okay.
Second.
Okay. All in favor?
Aye.
Great. Opposed? Perfect. We will approve the December minutes then. And Ken, since you're here, I'm just going to have you sign a couple of copies of that. Okay. I don't know that there was much in the way of old business, so we will jump to the new board business here. So Gary did tender a letter of he basically not seeking renewal based on the contracts he had with the county for the medical advisor and the health officer piece in January. So those are two separate roles. And just so that there's some clarity, the medical advisor piece is essentially the license number that we are operating under for vaccinating. It's the person who signs our, the person that signs our standing orders, the person that we would go to for medical guidance were we in a situation that we needed medical guidance. And so that's the piece I've been working on first, because that's honestly the more complex of the two in terms of having to switch things over. So there is an open legal notice in the newspaper right now, and commissioners are accepting letters of interest from folks. Carmen has actually submitted a letter of interest, which I'm very grateful for. And so that will get decided at the commissioners meeting tomorrow. They will appoint a medical advisor for the health department. And then once we have that in place, like it takes to warn everybody, when we switched from Tim to Gary, it took months to get everything switched over, finalized. It's just a big piece because we have to go through all of the vaccine ordering companies and all of our billing and get everything switched over. I'm hoping it will be easier this time around with our EHR. But I just anticipate, it's a lot of work to get everything switched over. So we will start working on that as soon as the new medical advisor is in place. And then for the health officer piece, we'll post that one separately and have to make a decision on that. And that one actually comes to the board, and then the board's recommendation for a health officer gets pushed to the commissioners for their final approval. So that process is slightly different. Okay.
If you're appointed, can you stay on the board as a?
Yes.
So we don't have to fill your seat.
Correct. Yes. Yes. Yep. Yes. There's really no conflict between the medical advisor. It's essentially filling two separate roles. Yeah. And that being said, speaking to Gary about it as well, and I talked to the commissioner about it, Gary is also interested in staying on the board as a board member, just not in these additional roles as the medical advisor and health officer. Yeah. So we don't actually have any open board positions, which is, yeah. And then the next thing I wanted to bring up to you guys is just the Confluence Conference. Last year they did the board, well, I guess I'll pause really quick. Any questions about the medical advisor, health officer stuff right now? Does that seem okay for the moment? Okay, I'm sorry, Gary, I'm sorry it's taking so long, but I appreciate your patience. Okay. So then the next piece is the Confluence Conference. So last year they offered for the first time a Board of Health member track at the Confluence Conference, which is the Confluence Public Health Alliance is a professional public health association in the state of Montana. It includes the Association of Montana Public Health Officials, the Montana Public Health Association, and the Montana Environmental Health Association. So those three associations have sort of a collaborative agreement under this umbrella of what they call Confluence, and they put on a big conference every year. Last year, they did this Board of Health track for the first time, and Barb and Laura were able to attend. And they just wanted to put that offer out there again to all of our board members. It's in Billings this year, which is less close than Helena last year. So that makes it more challenging, I think. It's April 14th and 15th. I think the Board of Health track goes for about a day and a half. But we would fund anyone to go, so we can, they give a reduced registration fee for Board of Health members, and then we can find the funds to cover hotel and that kind of thing. So you don't have to answer now, but if anybody's interested, let me know sooner than later, because we would get you guys registered to do that. And I think Barb and Laura got quite a bit out of it last year. So anyway, Barb, do you have any words on Confluence?
It definitely is worth attending. There was a lot of information about the roles of boards of health, or it was a really great conference.
Thanks. Yeah. Okay. So yeah, if anybody is interested in attending, let me know. Okay, then we'll just jump on. Any questions about that? Any other board business that we need to cover? Okay. Okay. We will jump on to some health department updates here. So I am going to, sorry guys online, I'm just going to keep like switching around on what I'm sharing here. We'll do a quick communicable disease update, and then how do I do this now? This one right here. Okay. So this is, I just pulled up numbers for you guys, and I was trying to just pull up respiratory illness season so you guys can kind of see where we've been at. So I went back to September 1st through yesterday with these numbers. I just put everything else in there too. So this isn't like this is just sort of a weird time frame, but it's kind of what we've seen since respiratory illness. So 38 COVID cases, 47 flu. And influenza, we don't usually do a full report on it unless it's a hospitalization or a death. So these are just like, someone walked into Carmen's clinic and had a rapid flu test, and that gets reported over to us. So I'd say with these numbers, like these are pretty high for Teton County. We've had a pretty busy respiratory illness season. These are, of course, tip of the iceberg. These are only people that feel sick enough to actually go see a healthcare provider and actually get a test done. And then particularly with the flu, what I would say is like the way these numbers are reported in aggregate, these are really only the ones that are coming from providers that are located here in Teton County. So if somebody goes to like a walk-in clinic in Great Falls, that's going to get counted in Cascade County, even if they're a Teton County resident, for influenza. we should in theory at least receive all of our COVID cases that are done, because we still have to do a full case report on COVID cases, which I'm hopeful will change in the future, because it's not, we're not really collecting that much information anymore. But so anyway, that's kind of our respiratory illness. RSV is not reportable, so I don't have numbers for that, but I've heard that, that's running around too. They actually did notify us that the vaccination season for RSV typically ends March 31st, and they're extending it through the end of April, so those vaccines are still available because RSV season has been bad enough. Sorry, this is for children. Adults can really get it anytime. With the children, children and pregnant women, it's kind of a set season around when we see RSV activity, and they've extended that for a month. We have not really had much demand for RSV vaccine, pediatric RSV vaccine. So we opted not to bring more vaccine in, because I don't think we'd use it, and it's very expensive. But we do still have a few doses on hand, and folks can reach out to us if they're interested. But I'm not anticipating we'll see an increase in people asking. We have also had a few other things going on. It's normal for us to have a few STI cases, couple of syphilis cases, which Teton County is kind of considered one of the counties that have higher rates of syphilis cases in the state. A few chlamydia cases. Then we've also had two vaccine preventable illnesses, so a few varicella cases, and there is a little outbreak happening. I would say it's pretty highly underreported, which just means kids aren't getting sick enough to, like a lot of parents are not taking their kids to get diagnosed by a healthcare provider, and nobody's getting hospitalized, which is good. We know that there's more cases than what have actually been reported or actually, been seen, but just haven't had a lot of response from families. And then we did have a pertussis case, which has thankfully not turned into more pertussis cases. So I think that one was probably associated with, there's been a pretty big pertussis outbreak in Cascade County, a lot of sporting events, wrestling tournaments that have possibly had kids with active pertussis, and so I think we're pretty lucky to have just so far one diagnosed case in Teton County. Yeah. And then we did have one case of recommending the rabies post-exposure prophylaxis, which doesn't happen too often that we actually recommend going through with the PEP, but this was one situation where we did. So that's kind of the communicable disease activity.
How do you decide to go through with it or not?
With rabies PEP?
Yeah.
There's a variety of factors. So generally, it's looking at, do we have an animal that we can observe for 10 days? So dogs and cats and ferrets, I think you can observe for 10 days. And if they don't show any signs of illness, you then are, essentially there wouldn't have been enough viral load of rabies to infect a person. With wild animals, if we still have the wild animal, we can send its brain in for testing. Same with livestock, you can send the brain in for testing to the state veterinary lab and base your decision off of those results. This situation was a feral cat, and the cat, she couldn't track it down. So feral cat, couldn't find it. We have no way of knowing. And then I'd say, so that's kind of the algorithm that we use to make a decision about whether or not we recommend it. And then from there, the patient usually goes on to talk to a healthcare provider, and the healthcare provider can talk about risk with them, right? So sometimes if you have a brand new kitten, right, that bites somebody, it's never been outside, the risk of, it hasn't been vaccinated yet, but the risk of rabies is very low, and so they would maybe opt not to do that, but that's really a decision between the patient and the healthcare provider. So we create a report on it regardless of whether or not they actually go through with it. This was a situation where the individual actually did complete the PEP series as well, so yeah.
Thank you.
Yeah. Okay. And then as far as flu and COVID numbers, I didn't put this on, oh, thank you. I didn't put this in my online, or sorry, I didn't create a document, but basically we are sitting at 708 doses of flu vaccination this season and 395 doses of COVID vaccine that we've administered this season. And I think that's about what I expected for the COVID, or it was maybe even a little higher than what we expected, so close to 400 doses. It's a little lower. We've typically done about 800 doses on flu. We are still giving them occasionally, but it's slowed down quite a bit at this point. So a little bit less uptake on the flu vaccine than we've seen the last few years. So, we're just now having to think about our orders for next year, so we'll probably reduce what we're purchasing so we don't end up with a lot of extra. It's so hard to predict what people will do. This could be an indication that there's better accessibility of flu vaccine in other locations. They could be getting it through their healthcare provider office or through pharmacies. Like I know the Fairfield Pharmacy is now offering flu vaccination to adults. Which is great. Like, access is what we want, I sort of anticipate that we will probably continue to see a drop in uptake next year. But I don't know that for sure. Who knows? So anyway, that's where we're at with that. Let's see what's next. Any questions on communicable disease, immunizations? I'll let Katie give a little update on billing.
So passing around basically 2 full years worth of data sets and then the start of this year's data, and mostly just so you can see the drop in there's been a drop each year, so this shows the trend that we're seeing in our vaccines too. So 2024, we did $276,000 worth of vaccines, and some of it was RSV and pneumonia. Like, there was a reason for the spike and increase, but then the following year we did about 74,000 less in vaccinations. And this year, for January, it was $2,000 less in vaccines. And February was $700 more than last year, but then March again is less than it had been historically. So this is just showing that trend is being shown through the years too, like as a total aggregate. But yeah, any questions about billing or EHR stuff? I thought that was kind of interesting and kind of backs up what we're seeing for our flu numbers and just verifies it as a second source.
Lower vaccinations, yep.
And again, I do feel like some of it is because that RSV vaccine, it's a 1-dose only series and it came out in that 2024, so that does impact it to a degree, but we're still seeing some of that drop for other things too. And some of it accessibility, some of it trends, a mix of everything, but it's definitely showing in the data. Any other questions or anything
So what would be an adjustment if someone refused to pay and you just write it off?
Sometimes it's also by the insurance. So they'll say we'll pay often for a $40, so you get the shot back. The vaccine has a price and the nurse has a price, and so the easiest one to say is nurse is $40. I usually get between $13 and $21 for it when I charge it. So that other 17 to whatever, that's all written off in an adjustment.
Different insurance companies pay at a different rate.
Yeah.
So would you go, if I refuse to pay my bill, would you come after me or send it to collections or?
No, and often that's not set as patient responsibility. You just have to write it off. You don't have a choice by the insurance companies. Very few end up being patient responsibility. The only ones that I have a few people who don't have insurance, and so there's a few insurances that you can bill your people, but only for one. You can send one bill out if it's through the state, and after that, you just have to write it off. And it's provided vaccines only charged at $21.
Yeah, and so it's not. So with the state provided vaccine, because we can charge a $21 administration fee for something if we use state provided vaccine, we can't charge anything for the vaccine itself because it's provided to us at no cost. we're not actually allowed to take people to collections over those vaccines still. And our general policy is we don't. I mean, it's like Katie said, like insurance is pretty good about covering things. If we're even allowed to balance bill, if somebody had a big balance, we would spend a significant amount of time trying to work with that individual, put them on a payment plan, trying to figure it out. But I think the reality of our situation is we would never want to take somebody to small claims court over vaccination fees. We would rather just write it off.
Any other questions?
No, that was, thank you.
Okay. You gonna do FEC?
Yep. So sent out those plans, and I actually worked on them last night, so there already has been some adjustments made. But are there anything, did you guys get a chance to read through those plans that were attached to the email?
Just need some number updates on a
Yes.
couple of them.
So I did those last night. I moved things around a lot, and so I actually think I might have put one of the wrong plans up instead of the current one. I have a lot of like current in progress part 3, and so I grabbed the wrong current in progress. But yeah, besides the number updates, was there anything else for them that you have thoughts on?
Do you want to go through them one by one, or
we could do that. So do you want to start with the specimen transport plan?
sounds great. And I do have
In general, I thought the content was good.
Good.
It was the records of distribution, which I guess is the,
Yeah.
is there maybe a way you just assign positions and not people? Then you never have to,
Yeah, and some of them have that, but because of the number part,
Okay.
especially when the cell phone, so like I've changed that in the past now, but like especially the like cell phone specific ones, it's a little hard because you need their
Yeah.
personal cell phones in there. Yeah. Okay, so specimen transport plan. Yeah, so record revision, that
let's
one.
look at it, and I can pull it up here too.
Okay. I think specimen transport plan had the least of things that I did last night because it was pretty, yeah. That one actually is the most generic and keeps it very general except for the phone numbers in the back, but none of those had changed since the last time I looked at that one. So anything for specimen transport in particular?
Nope.
Okay. The HON, and this one I did a few adjustments to it last night, so those are currently updated.
Just updating like numbers
Just a
of
few.
contacts
Yeah,
and
because
stuff.
I did a couple of control Fs to see if it was updated, but they had been put in as pictures, and so I didn't find it when I was double checking it for the quick send.
Yeah.
And so last night when I was like, oh, I gotta sit through and make sure that when I sat down, I found the ones that were not accessible through a shortcut through my keyboard, and then changed those ones out and actually deleted it from being a picture because I do think like having a quick method of searching a document is important. So I'm trying to get away, except for like graphs and specific things like that, I would like to stay away from pictures, that if you needed to find something quickly, that's an accessible option. So I changed out phone numbers, and I added a few little laptop adjustments. Yeah, anything else for HON?
Does this reflect, now, it's not really HON, but like our surveillance, is that included in this plan at all, our new surveillance process with the emails?
I did not put it in there, but we could put it in
I wonder if
here.
that would be a good, just a good place for that process.
That's a good idea.
I don't know if I shared this with you guys last time, and I meant to talk about it when I was doing the communicable disease updates. We shifted how we do our surveillance. Historically, we would always do a phone call once a week and call all the clinics, call the labs, call all of the reporting partners and say, hey, do you have anything to report this week? And we found it to be pretty cumbersome for the staff, and also I think we were annoying people with our phone calls. So we changed, and we just started sending out a surveillance email, and you guys, I think, should be included on
The
it.
Monday.
Yep, it has, yep, your Monday email. It has the link to the reportable, the list of reportable conditions. It has the state's update on communicable disease each week. And I blind copy people on it so people can just like respond directly to that. We've started including schools on it and long-term care facilities because again, we were calling schools, but it was a lot. It was a lot of phone calls to make and stuff. And it's been great. The schools are probably some of our best reporters. And when we saw, our spikes in respiratory illness in December and February, I very clearly saw, the 2 weeks leading up to that when we started seeing reported cases, the schools are like, oh, we got a lot of kids out sick. We're seeing a lot of this, we're seeing a lot of this. And so I think it's been working very, very well for us. Our clinics are still really good about faxing in, cases, flu cases or COVID cases when they have them, which is the kind of the preferred method for that. But it's just been great to just get like that kind of email response from folks about what's going on. So I think it's been a good process. I think we could, it's not exactly Han, but we kind of use the same Han network, so I think we could include that in this
I
plan
think
too.
it's quick communications. I think it totally could fall under there.
Yeah.
Okay. Anything else with Han? Okay. Emergency medical countermeasures. Same thing. There was I cleaned it up a little bit more too last night, and then. But were there any like fundamental things that you guys saw that needed adjustment or comments? This one actually I think had only like one thing on it, but I was like, oh, I just added a few more things to the back list, but.
Yeah, okay.
I would say all of these reports have gotten remarkably
Better.
better over the 5 years or so we've been looking at them.
Yep. I totally agree with that. And we always appreciate your guys' feedback. We've really made a concerted effort to make them usable plans and not just lengthy documents that are hard to read. Great. Okay, cool.
The other thing, I was
go
just
ahead.
going to say, in that same regards, the other thing is we've tried to make the same setup in this one as the same as all of them. So like all of them have the
Read the
same
same, yep.
order of operations, not just here, but even as much as we can for our personal health department ones, so that everyone has a lot of practice, and if they needed to go
That's
into
smart.
a plan, know where to look for and what is generally under each section.
Great.
Sorry, I didn't
No,
mean to cut
that's,
you off
thank
for
you,
that.
Katie, that's great. Okay, so I'm going to let Claire, any questions about FEP at all? Katie also did host a tabletop exercise around measles, this month, March, it was in March, right?
It was Henry's birthday.
Yeah, yeah. And it was great. It went really well. We had a lot of great partners turn out, and I feel relatively prepared in Teton County, so that's a positive thing.
Not a good statement to make.
Claire, do you want to go ahead and do some behavioral health stuff?
Yeah. Good morning, everyone. So right now, with our behavioral health projects and goals, we are actually starting to fill out some of our grant reporting. So I do have that pulled up on my end, so I can share some numbers with you. In January, we had our Rooted in Resiliency conference for the agricultural community, and for the very first conference, I feel like it was very successful. We had 43 participants and 6 speakers. We had topics covering things from like the financial portions of an ag business, having the state vet there, to suicide awareness in the ag community, land and legacy planning, which really focuses on family dynamics. It's a big one. It's not just writing your will or your trust and leaving it to people. It's making sure you have these very important conversations, which can really touch on like what the relationships are within that family. We did have surveys on the tables at the conference for people to fill out before they left, and 40% of those surveys were filled out, with 35% of the surveys stating that the land and legacy planning with Speaker Brent Turner was the most impactful, highlighting a significant community interest between the family of business dynamics and mental health. And then 22% cited Darla Tyler McSherry's Ask and Earnest Suicide Awareness presentation as the most valuable, understanding that the necessity of specialized behavioral health outreach to ensure that our ag community members are feeling supported. That was a one-day conference. We are going to be doing it again. Actually, we'll have 2 this year. So we did this in January. Some of the survey information that we got back stated that they prefer it in December, before the holidays and before school lets out. So we are going to be looking at December 12th this year to do the second Rooted in Resiliency conference. We have some new speakers coming in to tackle different things, and then we are going to have some of the some returning speakers, including Darla Tyler McSherry. She will be doing, not her Ask in Earnest, but she will be doing like a different mental health awareness presentation. So that went well. In January, at the CARES meeting, we had the Department of Justice come in. They sent 2 agents, a forensic examiner and the ICAC analysis. ICAC stands for Internet Crimes Against Children. It's a division of the Department of Justice. They do so much with online safety, dangers in the digital world. They travel throughout the state to give presentations to communities, schools, whoever is asking for it. And this was, we brought them in based on specific requests from Choteau schools. And getting them to come into CARES, they were able to present to our community stakeholders. We then scheduled for them to go to Choteau schools. We are also able to do outreach with our other schools. And so they went to all the high schools in Teton County to do a presentation. And I believe they did a community presentation in Power as well as Choteau. We did kind of like I guess it would be like a small community forum, maybe a little bit of a tabletop conversation with the 2 agents and then 7 community members. And they shared the different support systems that are available statewide as well as nationwide. Talked about actionable steps to take to maintain digital safety. It was a really good conversation. Some of the other things we have going on currently, we have a winter music series that's partnered with MSU Extension, Teton County Health Department, Teton County CARES, and Teton Pass. We are doing a 4 Saturday music series called Après Tunes. And really that's from one of the goals in our strategic plan that's focused around fostering connection and support for families. So this is a free music series. People are welcome to come up and listen to music, enjoy sitting outside, enjoy visiting with friends and family and neighbors. If they want to ski, they are more than welcome to ski, but there's nothing required of people coming to listen to music. Let me see. At the very first music series day, I did some qualitative data collection. I was able to talk with around 14 people who came up, who were willing to talk with me, because a lot of people were having a good time, and I didn't want to interrupt their music listening. But I talked with 14 people, 7 of which responded that they traveled to the venue specifically for the music because they had heard about it, and 3 had said that they planned their ski day to coincide with this specific event. So it seems to be, a good project that we came up with. In some of the future days for the music, we are going to utilize what Melissa, and I love the name she coined, what Melissa's calling the Babysitters Brigade. So these are local Teton youth who completed the 4-H babysitting boot camp that Shelby Jones offered in November and December of last year. And we are going to have them do what we're calling micro babysitting. So they will be at the ski hill, and parents can sign their kids up for maybe 20 or 30 minutes so that they can go get a run or 2 in with their spouse, with a friend, by themselves, whatever it is that they need to just get a little bit of brief respite. And just based on some of the information I was looking at and that I've talked with Shelby about, there is a lot of evidence-based research to indicate that these brief periods of respite can significantly improve parental mental health and reduce that emotional exhaustion. So we want to keep encouraging kind of like these micro volunteering or these like for these kids micro babysitting opportunities that are teaching these kids a lot of like leadership skills, as well as providing that mental health support for parents. We also, in conjunction with the North Central Crisis Coalition, have a online adult mental health first aid training coming up for March 31st. This will be done online. It's a 6-hour course with, I think, 1 or 2 hours of pre-work, a day or two before. It is currently free. They are not always free. We are able to make this specific training free for whoever would like to join. I am sending out more emails, and I can include anyone from the Board of Health who would like information on this mental health first aid training. Just let me know. It also will be in the paper. We have an ad and a PSA out. So we are really hoping people see this ad and want to join the training. Do you guys have any questions so far?
Claire, I'd like to be on that. If I could get information emailed, I'd appreciate it.
Absolutely, yeah. I will send you what I have.
Okay, thank you.
Yep, thanks, Barb. And let's see, a couple other things that did happen at our last CARES meeting at the beginning of March. John Tabb from Montana DPHHS came and presented on the integration between 988 Suicide and Crisis Lifeline with existing 911 dispatch protocols. I did not know that different sheriff's departments and police departments throughout Montana were signing MOUs with 988, which is really amazing, and Teton County is one of them. And so with this MOU, there is the option of having some trainers come out to work with first responders on how to identify when to call 988 and just what that looks like. I'm hoping they go through some of the legalities and liabilities, because I know that was a big topic of conversation in some past meetings that I've been a part of. So I'm going to reach out to Keith and see if he is interested in having some training come to Teton County for his deputies. John also has a few other projects that he is leading, one of which is really focusing on veteran suicide awareness and mental health. And so I'm not sure if Melissa, if you found them, but
I did.
Perfect. So he created these veteran coins, which I apologize for anyone who is a veteran. And if I understand it right, veterans can receive 2 of these coins, and if they see another veteran that they are maybe concerned about or they just care about, they can hand them this coin. It has the 988 number on it. I think it has maybe a little message of hope as well.
Claire,
and
let me pop up on the screen. I found a little bit of there's not a ton online about this program, but I did want to share because I think we have a lot of veterans in Teton County, and we would really love to see this program kind of up and running. So it's called the Montana Warriors Forward project. It used to be called the Governor's Challenge, but nobody really knew what that meant. So they changed the name of it. So it's been around for a while, but I mean, basically exactly like what Claire said is they've kind of piloted this program in a couple of places. Like I think Yellowstone County, Lewis and Clark County have started to use this program, but they have a bunch of different partners that reach out to, that have, are in contact with veterans, and they'd love to see this kind of spread across the state. But these are challenge coins. And the idea is that you essentially just pass them out to a veteran and give 2 at a time so they can keep one for themselves and pass another one on to someone else. And so we do have a stack of these, and I think we're just looking for maybe some folks in Teton County that would want to be champions of a program like this. And Ken, we thought of you because we know how involved you've been with that group with the Legion and such, so we can certainly talk about it if this is something, if you know some other folks in the community that would want to just have a handful of these, would feel comfortable approaching somebody that they think might be struggling, and just broach the conversation.
So let's set up something for a Legion meeting.
Great.
Okay.
We'd love that.
Okay,
Yeah.
good.
Yeah. And I think I'm not, like, Claire and I are maybe not I think we would very much like to pass this project into the hands of people who are far more connected with the veteran population than we are. So that would be perfect.
Absolutely.
Okay.
Yeah.
And then I have just a couple more updates. I am currently working with the Sunburst Lions Club. They are doing a lot of outreach throughout the North Central region, offering vision screenings. We haven't had them in parts of Teton County for a while, and so they will be coming to Teton County, specifically Power Schools, and I believe Bynum and Miller Colony next week to do vision screenings. We also got our schools connected with Smiles Across Montana for those who are not currently doing dental screening. So we are trying to make sure that we bring those back and our families have the ability to do these screenings at their schools, kind of taking away that transportation and time barrier that a lot of families are up against when kids have to go to school and you have to work, and sometimes the only time you can get in with a dentist or a optometrist is during the day. So we're trying to make sure we offer that. We are also working with Alliance for Youth on a fentanyl awareness project that's, I think, really going to coincide with the fentanyl watch parties that we received a grant. Alliance for Youth received this grant, this opioid grant, to focus on fentanyl. And so what we are doing with them is we are kind of umbrellaed under this grant is a fentanyl watch party. So this includes, I believe, there's a 2-hour video and a 1-hour video that they would like us to start kind of sharing throughout the county. And it's really supposed to kind of start a discussion with those who are watching it. So I guess I envision this as like watching this video and then just having a very, very interactive discussion with the community members who are there on what we saw, what maybe we see in our own community is steps we can take, things like that. So we have the fentanyl watch parties, and then we have this fentanyl awareness campaign, which includes, I believe they said, benches, magnets, posters, and popcorn bags that we can give to our schools as well as our movie theaters, that has facts on one side and I believe like a picture and a QR code on the other side. And then the last thing I have is that we did update our CARES strategic plan and released it in January, and we are currently, we've reviewed our MOU document and we are currently updating that document, and we'll be releasing it hopefully in the next month or two. But it might be after our confluence because that's coming up very quick. And that's all I have.
Thanks, Claire. Questions about behavioral health? Oh, sorry, that was all that. Claire's doing a lot of stuff.
She is. Sounds like she's doing it well.
Okay, great. Well, with that, I'm going to pass it over to Van and Delilah. If you guys don't mind just introducing yourselves. Thank you so much for being here. Tell us what's up with environmental health in Teton County.
Howdy, folks. Yeah, Van Puckett with Southwest Montana Consulting, Army reservist and also a veteran, so thanks for all you do with that. Zach, my other business partner, is also a reservist and a veteran, so that's we're pretty proud to be. Environmental health is going. It's as far as we know, it's going pretty well, and to start out the year, we got the school inspections completed. As you know, the schools need to be done twice a year, once in the spring and once in the fall. And so all those are done for the spring, and then we basically just kind of do the outlying, kind of the harder to reach inspections, and then we kind of work our way central. So at the end of the year or towards the end of the year, it's just a little bit easier, low-hanging fruit to manage. The other thing that we do is we try to share the costs with the other counties that we help out, and it just it helps with the mileage and with the time to be able to pick things up on the way. So we also help out the other area counties like Choteau County, Judith Basin, Jefferson. So we kind of do a big loop when we come through the area. And as far as the land use stuff, Brian's doing a great job helping us out with that. And, we didn't really ever have winter. So that kind of, construction just kind of kept going. And not too much else was going on. I guess we did have a couple of unofficial complaints that we followed up with and took care of. Both Zach and I are both former high school biology and chemistry teachers, so we kind of that's kind of our angle, is we like to educate when we do the inspections and when we follow up on these complaints. So for the most part, Teton County is very receptive and doing pretty well overall. Any questions for me?
Where do those reports go? Do you get them? Do they go to the state?
Yeah, Van, talk to us about the, you mean the complaints, the unofficial
and
complaints?
the school inspections.
So the inspections, Van, is the new system for reporting the inspections up and running, or is that still?
It is not. It's on hold. So yeah, it was supposed to roll out last summer. They've just been having a lot of problems with the new system. And on, I believe it was last Tuesday, we had a DPHHS meeting, and they basically said it's on indefinite hold at this point.
So are you guys still reporting into an old system then, or what is the process for, what do you do with those reports?
Yeah, so we, obviously they're just a paper report, and so we take one and one copy and we scan it into the state database, and so that's how, I don't know if you know how this works, but so the license fees that people pay for their public establishment licenses, about 85% of that fee goes back to the county when they are inspected. So we kind of try to pay for ourselves when we do these inspections. We're coming through and we're knocking out a whole bunch of inspections at a time. Obviously, the main focus of it is public safety, and then the education of the operators. But then the third part is to get the county basically reimbursed for what we do. And so that's kind of how that system works. And then the fees increased this year. The license establishment fees increased, so they're actually a lot closer to paying for the actual inspections.
Did that answer the question, Ken?
How about the school ones? You said they do school ones twice a year?
Same. I think that
Same thing.
they're done on paper and then uploaded to the state, right? Van, the schools are licensed establishments the same as.
Yes, and everybody gets a copy of their inspection. The schools are really good about hanging those inspections in their kitchens, so they can kind of work off of them and know where their improvements are needed. So.
Okay, that answered the question. Thank you.
You're welcome. And sorry, I talked over Delilah, but go ahead and introduce yourself, Chief.
Hi, I'm Delilah. I'm Van's daughter. I'm newly joined with Southwest Montana Consulting. I can't say I do a whole lot more than Van, but I think he covered most of it. I'm mainly just the tech person. I'm the one that uploads most of the inspections he and Zach do up to the FCS website for DPHHS. And yeah, sometimes I talk with Brian about some septic permitting or septic questions, but that's about as far as I go.
Yeah, so I don't know if any of you are aware of Barb Kingery. She used to be the head of DEQ land use and so she retired in December, and she kind of had Delilah under her wing, so that's why she does most of the land use permitting, and you know, if somebody needs an exemption review for a property split or something like that, that's kind of her specialty.
Great. Well, I guess I would just say my experience is we do occasionally still get phone calls to the health department, but like at this point I say, oh, well, you'll need to talk to, you know, our contract sanitarian, and at this point everybody's like, oh yeah, we know Van. Like, I think these guys are super accessible and they've been great for Teton County. They're really answering people's questions and get back to people quickly, and we appreciate you guys.
Likewise, well, it's an honor to work with you.
Any other questions for Van or sanitarian stuff? Okay, awesome. Well, thanks you guys for being here. And is there anything else for the good of the order today?
No, just if you have cards, just pass them out and give them our contact information. So if they do come across something, they can let us know.
Okay, that sounds perfect.
All right, thanks so much.
Thank you. Okay, I think with that we'll adjourn. Thanks, guys.
Okay, the other thing I was
Thank
gonna
you.
tell
Thank
is
you.
after a year, if
Thanks,
you have
Melissa.
a payment or anything, you have to write it off.
Okay.
So then